Medicines Regulatory Council is a statutory body established in terms of the Medicines and Related Substances Control Act, Act 13 of 2003, to regulate the use of medicines in Namibia. Recently, the regulatory body issued a withdrawal of all Pholcodine containing products from the Namibian market. We're now joined in studio by Anna Shimbulu, who is the Senior Pharmacist in charge of the Therapeutics Information and Pharmacovigilance Center. Anna, good evening and welcome.
Good evening, Nina.
Thank you so much for being here.
Thank you.
Just to start with, Anna, talk to us about, what the duties and functions of the Therapeutics Information and Pharmacovigilance Center is, and how you work together with the Medicine Regulatory Council.
Okay. Thank you for the question. So the Therapeutics Information and Pharmacovigilance Center, shortened as TIPC, is actually an administrative arm or a technical arm that supports this body, the Medicines Regulatory Council, in overseeing all the technical issues related to safety monitoring of products on the Namibian market. So it is responsible for, therefore, collecting adverse drug reactions that are reported to the use of medicines. It's responsible for collating that data, analyzing the data, and making it available for the council to make any regulatory decisions with regards to any safety alert pertaining or arising from this data.
Help us understand how important it is that there's a monitoring system on medication.
Yeah, that is very, very critical, considering the fact that products before they are released onto the market have only undergone clinical trials. So that means they have not yet been exposed to a broader group of people to which they are going to be exposed when they go into the market. So the safety data is very limited at this point in time. So it's only through monitoring post-marketing, when the product is being followed up through its life cycle, do we get to learn and establish the full safety profile of this product. That means we learn to get to understand which products it interacts with, which populations are most likely to be at risk, how different populations actually respond to this product, and how it also responds to population with other diseases, a population that was never included in clinical trials. So it's very, very important to have a stringent and effective monitoring system that captures this information and then advises regulatory decisions.
As I mentioned earlier, there was a release from the Medicines from the Medicines Regulatory Council saying that all medicines that contain Pholcodine need to be removed from the market. Talk to us about what informed this decision.
Okay. Perhaps I could start by providing a bit of more clarity in terms of this public notice. So this public notice was released by the Office of the Registrar of Medicine, who is secretary to this council. So it is a precautionary measure or a temporary action pending the council's decision on the way forward, on a long-term way forward. You might be aware that the new council was recently inaugurated by the Minister of Health to serve for the next 3 years. So it is this council that has to now look into the issues surrounding Pholcodine and make the final decision. However, the Office of the Register of Medicines used a reliance mechanism to withdraw this product from the market as a temporary precaution for the sake of protecting patient safety while the council makes the final decision on the way forward.
A precautionary measure, as you mentioned, against what exactly? What is harmful about this product?
Yeah, so the Pholcodine containing products, there's new data that emerged that suggested that the use of Pholcodine containing products within the 12 months prior use of anesthetic product or anesthesia using anesthesia a group of anesthesia called neuromuscular blockers exposes you or increase your risk of getting anaphylactic reaction, which is a sudden and a severe, quite life-threatening allergic reaction. So that means that you are most likely, or you are likely to be at the risk of having anaphylaxis if you have taken Pholcodine containing products within those 12 months prior to the use of neuromuscular blockers, as compared to somebody who's just used neuromuscular blockers alone. So this is the safety risk. This is associated to the Pholcodine containing products.
You mentioned that this was also done, to take these products from the shelves as a interim measure while this new board then establishes, the facts around this product. Should it then be established that it's safe to consume, or whatever the case may be, what then happens thereafter with all the customers that have now purchased it and then, gotten rid or destroyed these products that they've bought from different pharmacies?
Yeah. So the precautionary measure entails that so the marketing authorization holders should withhold availing this product to the different suppliers. The healthcare providers should not prescribe or issue the sale of this product to patients who are, it's usually taken for dry cough, so who need dry cough. Instead, they should use alternative products which are also available already on the Namibian market, and also advise patients who already has or are taking that product to basically just stop taking the product for now.
Do consumers have a full understanding of the dangers associated with these medicines that have been withdrawn from the market? And if not, Anna, what more needs to be understood?
Yeah, I guess generally in terms of what needs to be understood or what needs to be done is that there's obviously a need for more public awareness and public engagement. As we have the Office of the Register of Medicine has released this public notice, there is a need to ensure that this information reaches the end user, basically the patient who ultimately use this product. So generally we communicate as far as we can, but I think there's more that needs to be done to ensure that this information truly reaches the people or the end users who it is targeted for.
Fantastic. Any final remarks from you this evening, Anna?
Yeah, maybe just final remarks is just to encourage the marketing authorization holders, importers, healthcare professionals, in light of this new directive from the Office of the Register of Medicine, to put it into action. It is for the safety of the patient, and also generally when patients are experiencing any adverse drug reactions due to any medicines that they use, to always just notify the medicines regulator, because it is through this information voluntary that is provided that regulatory decisions can be made to establish the safety of the product on the Namibian market.
Anna Shimbulu, thank you so much for taking time out to be with us this evening.
Thank you.